Since the day this government was elected, healthcare has been one of our top priorities. Today, I would like to highlight the progress that has been made since we set out 3 years ago to change the course of healthcare in this province, and to illustrate for Islanders the continuing challenge and the significant opportunities that we have before us in health. The challenge, simply put, is to slow the growth of health spending and to shift more resources to areas where we get better health outcomes and more value for taxpayers' dollars. Health spending in Prince Edward Island, and indeed across Canada, is now outpacing our ability to pay. We have never spent more on health care. Health now takes over 40 cents from every taxpayer dollar and will soon take much more if we continue to spend the way we did in the past. Across the country, many people are now asking the question, how much is enough to spend on health? And others are asking, how do we use existing resources better without adding more? Today, we are facing historic lows in federal healthcare funding. Federal Minister Jim Flaherty unilaterally announced in December that healthcare transfers will grow at 6% a year until 2016-17. After that, increases will be based on individual provinces' economic growth. That simply does not provide PEI with the same resources as the rest of the country. Added to this is our demographic challenge. By the year 2020, 1 in 5 Islanders will be over 65. And over the next 25 years, the number of seniors in this province will double. An older population will place even more pressure on the healthcare system. With major challenges ahead, many people are questioning the capacity of our health service delivery models. Unfortunately, our current healthcare model has remained relatively unchanged since the introduction of Medicare. And it is still very much about doctors and hospitals, and about treating people after they are sick. Globe and Mail reporter Andre Bacard referred to the issue at a public policy forum recently at Dalhousie University last month by saying, "We are trying to deliver 21st century care with a 1950 system, and we're trying to ensure a population of chronically ill citizens with an acute care insurance scheme. That's why we're spending too much on health care delivery." Even though we are spending more money on health care than ever before, even though we have more health professionals than ever before, and even with our modern facilities, equipment, and life-saving drugs, we are not getting any healthier. Islanders still have some of the highest rates of chronic disease in the country. It is time to increase our focus on promoting health and preventing illness. Time to start talking about solutions. And time to end the adversarial talk surrounding health care. This discussion has to transcend politics. Our vision has to be long. The decisions we make today will determine the viability of our health services in the future. I've learned from my experience that good public policy needs good public debate. In the coming months, I will be traveling the island to talk to Islanders about their healthcare system. I will be announcing more details of this endeavor in coming months. Prince Edward Island began the transformation of healthcare in 2009 following a comprehensive review by Corporate Sanchez. The review showed that immediate investments were needed in home and primary care and the way we staff health facilities. We listened to the experts and we made bold decisions that have reshaped our healthcare system. One area we know we can improve is the way we are using our acute hospitals. Over the last few years, Kings County Memorial Hospital has been providing emergency department services on reduced hours. This has taken significant pressure off our healthcare workers without negatively impacting patient safety. The hours of operation of the emergency department at Kings County Memorial Hospital will permanently be reduced to 14 hours. Also, the opening of the Time Valley Health Center, there has been significant duplication in having both healthcare center and outpatient departments at the Stewart Memorial Hospital. I have approved the closure of the outpatient department at Stewart Memorial Hospital and have directed Health PEI to implement this decision in an appropriate period of time that will allow for proper planning with physician staff and community. Dialysis, there's been a 75% increase in hemodialysis patients in PEI this past 3 years. To meet the rising demand for hemodialysis beginning October 1st, we will be consolidating hemodialysis clinics at Western, QEH, PCH, and Surrey into 2 clinics at the QEH and the PCH. 5 new dialysis seats are being added in a $250,000 investment. This will improve the use of our human resources. Demand for ground ambulance services is steadily increasing as the number of seniors on Prince Edward Island grows. Ground ambulance costs have increased 50% in the last 5 years. As of October 1st, those over 65 will now pay a $75 copay, a small fraction of the full cost of a ground ambulance transport. In 2009, we eliminated the fee of $150 for seniors and are reinstating 50% of that cost. This fee is half of what seniors were paying prior to April 2009. Children's dental coverage. The province is moving to a public model of dental care for children and will become the payer of last resort, available to families without private insurance who make less than $35,000 a year. Moving to this model will ensure the Children's Basic Dental Care Program is available in the future for those who need it the most. Our dental hygienists and assistants will continue to provide preventive care in schools and other sites. We will be undertaking an independent expert review of mental health and addiction services across all government departments to ensure that these services are meeting the high standards that Islanders expect. We've developed a provincial wellness strategy which will be implemented in the coming months. The goal of the strategy is to encourage and support Islanders to improve their quality of life by reducing risk factors for chronic disease. We are encouraged by what we have accomplished, and we are very committed to doing more. The success of our health system does not rest solely with government. It rests with me, with you, with the opposition, with all of us. This government is going to keep on the right track to transform our health system into the most efficient, safest, smartest one in the country. The 3-year health plan will see contained growth in health spending to 4.1% this year and 3.5% the following 2 years. Despite having the lowest fiscal capacity in the country, we're fourth in health spending to only Quebec, Alberta, and Saskatchewan. Over the next 3 years, we will invest $1.7 billion into strengthening Prince Edward Island's healthcare system. Our Premier and Saskatchewan Premier Brad Wall have been tasked to co-chair a national working group on healthcare innovation. We have much to learn through their process and opportunities to pioneer innovative solutions to healthcare challenges. Because of our small size and single health authority, solutions can be rolled out with standards and processes in Prince Edward Island. We are in a strong position to deliver integrated, safer care for Islanders and a system that is sustainable as we make it. I would like to call on all Islanders to take charge of our health and to be part of the solutions that will ensure our excellent healthcare system is a reality for future generations. Thank you.